Hey Remedies, so today I'm here to do the first video in my reflux series that I'm going to start here on my channel. I just kind of felt like information was kind of lacking on YouTube about this, so I wanted to go ahead and put it out there. I do have my laptop propped up and I'm going to be sitting to the side because I am going to be listing some stuff, so I will keep it here on the screen for you guys, also inserting some pictures and stuff. But all this information is going to be in a Google Doc down below for you guys, so you could check that out. I'm going to have little infographics and stuff that you could even save to your phone inside of that Google Doc, so it's easy for you guys to remember some of this information. I made all of those infographics for a breastfeeding support group that I help admin, but you guys are welcome to share those wherever you need to and keep those for yourselves if you need to. So I'm just going to go ahead and get started. Obviously, I'm not a medical professional and you need to go to a medical professional with any kind of concerns that you have. Now, like I said, this is just going to be the first video in this series on my channel. I'm going to have more in the future. I'm going to have a video for each one of the girls' journeys just because they were so different when it came to reflux. But this one, I'm going to be talking about the symptoms of reflux, the differences, and a whole bunch of different terminology, some kind of at-home remedies that you can use, and there's just a bunch of different stuff. So I'm going to go ahead and get started. First, I'm going to name you the differences and the different kind of terms I'll be using. Really beneficial to watch just so you know what I'm talking about. Then after that, I'm going to be going over the symptoms of each different ones. And then at the very end, I will be listing some of those remedies, and then a little bit at the end of the video, just me talking. But if you do have any kind of specific requests, leave them down in the comments below and I will check them out. Okay, to just jump right into the video, as a first-time mom, I knew nothing about reflux. I read several books while I was pregnant, when she was here, and everything in between about all kinds of different stuff, and they never mentioned any kind of symptoms or heads up about reflux. Now, I kind of understand why this is though. Reflux is widely overdiagnosed, so they don't want to put a ton of information out there, maybe scare parents into something that really isn't there. But at the same time, I feel like knowledge also needs to be easily accessible so that if they are going through it, they can educate themselves. So that was another reason for me wanting to do this type of video. It's very important to understand that spit up, infant reflux, and infant GERD are not synonymous. They don't all go together. They don't mean the same things. And it's important to know the difference so it can help you get the help that you need faster. So the first one that I'm going to be talking about is infant spit up. I'm going to be inserting pictures and words and stuff like that right over here. So like I said, that's why I'm a little off center today. But infant spit up is usually, but not always, a pretty common thing in babies. It's caused by an immature lower sphincter. Like I said, a picture should be inserted right here for you guys. Basically what that means is that the sphincter is not closing when it should, and if it did, it would prevent the spit up. So babies who spit up and they don't have any discomfort and they're not having any weight gain issues are typically referred to as happy spitters, and they will outgrow the spitting up. So reflux is when stomach acid backs its way up into the esophagus. And infants who have this will show, sometimes not obvious, but some kind of signs of discomfort, whether it's during the refluxing or shortly after. Like I said, I will be mentioning some symptoms and signs that you can watch out for here in a few seconds. Now, reflux and GERD are closely related, but they are not synonymous, like I said. GERD is the unusual frequency of refluxing to a severe degree, and GERD can cause some serious health concerns. So now I'm just going to go through the symptoms of each of those. Like I said, I will be listing them right here so you guys can grab a screenshot if necessary. If you don't want to grab a screenshot with my face in it, like I said, check out the Google Doc down below. I will have infographics that you can save to your phone. But first up is the happy spitter. Happy spitters are going to spit up, but it's not going to be forceful. It's not going to cause them any kind of pain, and you're not going to see any kind of weight gain issues with them. Now on to regular infant reflux symptoms. I'm going to be looking down at my laptop so I do not miss any of them, and I do have something to mention at the end of this list. So the symptoms include, but are not limited to, fussiness while eating, frequent hiccups, soothe when upright, difficulty eating, gas, excessive crying, frequent spitting up, difficulty sleeping soundly, gagging and choking, snoring, arching of the back, refusal to feed, and also frequent discomfort. Now, some of these are completely normal newborn symptoms, like the hiccups or the gas. It's just their body working stuff out. but paired with discomfort or weight gain issues, it may further indicate reflux may be a problem. So when it comes to silent infant reflux, those babies can have all the symptoms I just listed, but they are not going to spit up nearly as often or at all. Oftentimes you may hear them reflux, but you may not see anything. But they may show signs of discomfort by crying or arching their back or making a sour face shortly after you've heard that noise. It's kind of hard to explain the reflux sound. I know it as a mom who's been here twice, but I guess the best way I could describe it is the sound you make right before you vomit. The difference with a baby who's suffering from silent refluxes is they normally swallow most, if not all of it. So you'll hear that noise with like little to no evidence. So when it comes to babies who are suffering from GERD, they may have the same regular infant reflux symptoms I've already stated. They also may not vomit anything at all or very little, but the difference is that the GERD symptoms will be chronic and intense. So if you suspect your child may have GERD, I highly suggest you call your pediatrician as soon as possible. There is a lengthy list with the GERD symptoms too, so I'm going to be looking down, but the symptoms are a failure to thrive diagnosis, frequent vomiting, weight loss, breathing problems, wheezing, frequent pneumonia, chronic ear infections, feeding aversion, sleep apnea, frequent coughing, hoarseness, poor weight gain, and inconsolable fussiness. So on to the at-home remedies that I had been talking about. These by no means are supposed to replace the medical interventions that your child may need or your medical team may suggest. These are just a really great place to start if you're waiting for a pediatrician visit or waiting to go see a specialist. Now, as with anything else in the world, some of these are going to work for some people and some of these are not, so it's really going to be hit or miss. But a couple that I go to first thing a mom expresses some reflux concerns with me is, number one, a probiotic. A probiotic for a baby is a great thing, but also if you're breastfeeding, I would recommend you getting on one too. The most asked question I get with that recommendation is where to find one. My local health store carries them, not necessarily like Walmart or Walgreens, like a specified like supplement store, vitamin store, things like that. Or you can find a ton on Amazon. So if a mom is breastfeeding, the second thing that I recommend, and I would recommend it first if it wasn't so taxing and kind of difficult for most people, but it's an elimination diet. Now there are a ton of different versions. Find what one works for you, what you would like to try. Like I said, it's really hard, so I understand the difficulties in it, but the one I mainly tell moms to start with is the dairy. Cutting dairy out can make a big difference. With Sophie, it didn't seem to matter, but with Remy, I do notice a difference with her if I'm on or off dairy. Now, it will take about 4 to 6 weeks to leave both you and the baby's system, so you do need to give it that length of time to really judge to see if it's working. If you do dairy and it doesn't seem to do anything, you could start going a little more in depth with it, you know, hitting eggs, soy, nuts. I mean, I know moms who cut out a lot of different things just to see if it would help. Now, if you are a formula feeding mom, I would recommend maybe switching to a different formula, one that has a more broken down milk protein that's easier to digest. These are typically more expensive. That drives me insane. I'm so sorry if you're in that position, but formulas like Alimentum or Nutramigen, they can be really helpful for babies who have a difficulty breaking down that milk protein. Now, if you've tried those and they don't seem to work, I would talk to your pediatrician, because I do believe that there are 2 more formulas that are prescription based and they could possibly help your child more. I'm not 100% on this, but I think they either do not include the milk protein or they have it even further broken down. So I would definitely ask about that if your child's struggling on their formula. So the next thing that I would recommend is having your baby inclined at 30 degrees all the time. And I mean all of the time. If Sophie was playing on the floor, she was propped up with a boppy. We had something on our change pad to help prop her up then when we were changing her diaper. We had her mattress propped. All the time, people. It really does help. With that, also, frequent burping is a must. Whether you're nursing, bottle feeding, doesn't matter. Frequent burping helps a ton. If you are using bottles, using a bottle with a venting system like Dr. Brown's, MAM, Tommy Tippy, anti-colic, I mean, I could go on forever. There's a lot of them. So anything that's going to help reduce the amount of air in the bottle is a great thing. Swaddling, massage therapy, taking your baby to a chiropractor, and baby wearing can also help. You could also look into some hazelwood jewelry. That is something that I looked into myself. I will have a link down below to a website called Hazelaid. Highly, highly, highly recommend them. They are a Canadian family-based company. I love them. I get all of our Baltic Amber jewelry from there, and they've been great. They also do sell the hazelwood jewelry, and basically the idea behind that is that the wood is going to rest and warm to your child's skin, and then it's going to help absorb the acidity in their skin, therefore balancing their pH a bit and helping with the infant reflux. So definitely check that out. Also, Hazelaid is really great. They have a ton of information on how their products work, so make sure to kind of like navigate through their website so you can really get an understanding about it. Also, eliminating exposure to cigarette smoke is a huge one that can help a lot. And also, lastly, is Camila. I'm going to spell it right here for you guys because I may not be pronouncing it correctly, but it is something that I looked into and I did do with Remy. It did help her, but I would say ask a pediatrician first. I talked to mine. You should definitely talk to yours. And then lastly, I just want to mention another huge recommendation that I have for you guys is to do your research and then do it again. You can never be too educated in something, especially when it comes to your child's health. Like I said, as a first-time mom, I knew absolutely nothing about what was going on, and I went from a 0 to like 100 because I also am the type of person that when I know more, I feel better. So that's something that I really try to just allow myself to do, but it's also really beneficial. You're going to go to doctor's appointments if, you know, your child has a little bit more of a severe case. You may see specialists, you may have special tests done. So to understand what they're talking about helps a lot. Trust me. Also, don't be afraid to ask them questions. Don't be afraid to call. When Sophie was going through this, I called my pediatrician's office like 3 times a day, I would say at least. And I don't regret that at all. That's what they're there for. They are your doctors. They are there to reassure you that, you know, of any kind of concern that you have. That's their job. So things like that, or a nurse hotline where you can call. Unfortunately, my pediatrician's office doesn't have that, but I've heard a lot of people say that their pediatrician's office offers that. Also, finding an area of what you would like a say in and what you want to leave to others is a really important balance to keep. That was something that I had a difficult time doing, and I almost kind of just let everybody else take the reins, but I'm really glad that I didn't. She's like whimpering. Lastly, I just want to mention that it's really important to keep a balance between the things that you're comfortable with and the things that you need to give to other people to handle. That could mean a variety of different things, but what I mean is that in both of our experiences, there were things I wanted to say in, things that I felt like was my priority to speak up on, and there were other things that I sat down because I don't know anything about that, and I'm going to trust you and I'm going to let you take the wheel here. So that balance to me was really important, and my medical team was very respectful, and I definitely encourage that. I was told a lot that you would acquire this mom gut, the dad gut, just a feeling when you know your children as well as you do, that, you know, you should speak up about it, and I definitely encourage that. If you have something to say, talk to your medical professionals. Like I said, that's what they're there for. So that is everything for this video. Like I mentioned, I will be having 2 more videos. I will be talking about my oldest daughter, Sophie, who is now 2, her journey with regular infant reflux. She also was failure to thrive. And then in a separate video, I will be talking about my youngest daughter, Remy, who is now 9 months old, and she had silent infant reflux, and she also developed a feeding aversion. So those videos will be coming shortly. Like I mentioned, if you have any requests for specific videos, please leave them down below. I do have a infant reflux must-have videos that needs to get done because I feel like as a mom who's been through this twice, we've now gotten a lot of baby stuff that's just geared around infant reflux, as sad as that sounds. But I did want to say that I hope this video was helpful. I hope it made you feel a little bit more informed. If you think your child is going through this, I'm super sorry. Like I said, I know it is super, super exhausting. I hope that you guys find your answers soon. And trust me, that day will come. It may not be right around the corner, but it will. It's not going to be forever. But yeah, I hope you guys enjoyed the video. And as always, thanks for watching.